it's a master disaster here in New York City. My office is located in the financial district, Wall Street, which is now a ghost town. Um, People who came to my clinic were transient. In other words, they lived in the suburbs or they lived in one of the outer boroughs of Manhattan. And beginning in last February, they were told to start working from home as the grand experiment in case we went into lockdown. And as of March 14th, we went into lockdown. Many practices in New York State were erroneously shut down by the governor, meaning doctors of acupuncture, such as myself, physical therapists. We had to fight and hire attorneys to prove ourselves as being essential medical professionals, if you can believe that. But by the time that had happened, the damage was already done. The fear that clients had of traveling the subways or coming into Manhattan, it was as if you came into Manhattan, you automatically were going to have COVID. So business was literally null and non-existent. I can only speak for the New York City subway system, which I need to take to get to a new office location I have right now. I've signed on with a concierge medical service in a different part of town that's much more populated. Because of course we all need to make money and find new patient pools. But the New York City subway system has never been this clean. Quite frankly, there are many days I have the entire subway car to myself. It's crazy. There's just no one, not any, and the population riding the subway is nothing close to what it used to be pre-COVID. So you basically, aside from the increase in crime on the subway system because of the fact no one's riding the system, when you are in the train, for once you have a clean subway car. I mean, it's totally insane. Manhattan I've never seen this, and I'm born and bred. I've been here many, many years. I have never seen this. I leave my home. I have a mask on. I descend into the subway system. I wear gloves. I look around to make sure there aren't any crazies because, as I said, the crime rate has gone up. I get into the subway car. I try not to sit. I stand. I don't touch anything. I go about 4 express stops. I leave, I ascend the stairs, I get into the office, I disinfect my hands, even though I've had my gloves on. I go in and then I wash my hands in the restroom, and I start my day, and that's what I do on my way home. And well, first of all, we follow very strict guidelines that have been suggested by the CDC. Every single patient must wear a mask. They must have their blood oxygen and temperature taken when they enter the facility. They have to sanitize their hands. We ask patients to show up no more than 5 minutes prior to their appointment. We take them immediately inside the treatment room. They're treated, and aside from using the restroom to freshen up, they're asked to leave immediately. There's no sitting in the waiting room. The rooms are completely sanitized, even more so than they ever were. Usually there's a half hour in between each patient occupying a room, so these protocols can be performed.